Life can throw curveballs your way and test your resilience to the limit. While it may be easy to talk through the TV about the importance of bouncing back and moving forwards from life-changing events, that doesn't mean it's easy. It takes strength and determination. Hello everyone and welcome to the Chrissy B Show, the UK's only TV programme that's dedicated to your mental health and well-being. And on today's show, we are going to be talking to a very special guest that used her life-changing event to help others. Emily Hodge was diagnosed with bowel cancer shortly after becoming a newlywed and battled the disease for many years. Now she's recovered and will be telling us how her ordeals led her to found her own well-being business. Alongside this, we'll also be featuring top tips from some of our resident experts, including careers expert Coach Chris Browne, who'll be telling us how to avoid boredom at work, and our resident Dr Rob Hicks will be joining us to answer your medical questions. Plus, Natalia Kotowska will be showing us some top exercise tips. But first, let's head over to St Michael's Primary School in the heart of Hertfordshire to see how the children got on there doing the official MHD challenge.
Hello, Mr. Hayes. Sorry to interrupt you.
No problem.
I just wondered whether your children would be interested in joining our MHD challenge.
I think they might.
Would you like to? Ready? Let's go! Today with years 5 and 6 at St Michael's Church of England School in Bishop Stortford, and today we are going to be doing the MHD challenge. Have you been practicing? Yes. So we're going to do a little bit of practicing together, yeah, and then we're going to do the real thing all together, yeah. I just want to tell you a little bit about why we've been going round schools and telling people about the challenge itself. So Chrissy, she decided to come up with the dance, yeah, the challenge. And the reason why she did that is because when she was maybe a similar age or a little bit older to you, she found it very difficult to talk about feelings that were bothering her. And so what she's decided to do is when she worked through that and she found that it was really helpful to be able to talk about feelings and her feelings of depression, she wanted to share that with everybody. So with the dance, it's got a meaning behind it. There are lots of things in the actual movements themselves, saying no to depression and punching away our worries, not punching people, but punching away our worries. So when you're doing the moves, yes, I want you to have loads of fun and join in, but I also want you to have a think about the reasons why we're doing it, yeah?
Ask you a little bit about the dance. What did you think about the dance?
I thought that it was really fun and that it was really good because then it helps you, if you're being bullied, it can help you not to be stressed and it can help you calm down.
Fantastic. And what was the best bit about the dance for you?
The freestyle, because it was funny, you could do your own moves.
So now I'm here with head teacher Mrs Dale and just want to ask her a couple of questions. So what did you think about the challenge when you heard about it? What made you want to bring the challenge to your school?
Well, we've done a lot of work on mindfulness as a school before, so it seemed to be a good thing to progress from that, and we tried to be a creative school, so bringing dance in and being able to get those messages across through dance seemed the right thing to do. It was lovely to see them doing something like that together, and great the freestyle. Some of the year 5 boys and I did a bit of a robot thing in a line, which was good fun. Not the sort of thing I'd normally be doing on a Wednesday afternoon. So yeah, it was great to see everyone doing that together.
Fantastic. And finally, how will you sort of use this as a sort of a platform to continue talking about mental health in school?
Yeah, it is a platform because we can then reach out to other members of our school community. So now, because of this, the parents are also involved, and therefore, hopefully, that would open up some discussion and some awareness of the issues for parents as well as children in school. But it allows us to use it as a platform for all members of our school community, staff and governors, and to see where we want to take it from here in the future.
So it's been fantastic. As I say, thank you so much for inviting us into your school, and it gives me great pleasure to present you with our official Chrissy B Show participative certificate.
Thank you very much.
Well done. So thanks very much, everyone. Back to you in the studio.
Thank you so much to everyone over at St Michael's and to Sharon Lawton for such a great take on the MHD challenge. And if you want to know more about the challenge, visit our website chrissybshow.tv and stay tuned for even more schools and other establishments doing the challenge very soon. But now it's time to see Natalia Kotowska with some fitness tips.
Hey guys, it's again me, Natalia, and Katie with Nat. I would like to present you today the exercise for your core. So upper body strength, abdominals, obliques. So our position is sitting position. So it's all for the home base exercises. So the carpet, mat, whatever you have around you will be perfect. You're just lying. Make sure there is a 90 degree between your knees, your heels, and your hips. You're lying in between the floor and between your knees, so 45 degree. Now we're gonna do the exercise called the Russian twist. You wanna lift your heels off the floor. You can have your feet together. That's more advanced version. You can have your feet cross, and you're gonna move from one side to the other side. Now, in order to make it right, try to spot. So try to find one spot in front of you that you will keep looking at. So you're making sure that your torso go all the way to the side. You can pick something. You can take a bottle of water or 5 kg, whatever is around you, whatever you want to pick, or you can go just from one side without anything to the other side. You're moving 1, 2, 1, 2, and you're going as fast as possible. You can increase that with the weight on, bottle of water. Sometimes I take 5 liters of water and I move from one side to another side. That's the Russian twist. Now you make sure your chest is nice and open, you're looking forward, you're breathing in and out while you're doing exercise. Never stop breathing, because that's the worst thing that you can do. Your muscles need a food, and the air is the food. So you move from one side to another and you go. Again, you count to 12, 15, 18, 20, you do 3, 5, 7 sets, however you would like. As many as possible, you go as fast as possible and you move. You pick something, you pick, or you just move and touch the floor from one side to another side. So that exercise is called the Russian twist, and it will give you very nice abs, obliques. It will help your posture, it will help to strengthen your back. It's very beneficial, so nothing better to do but Russian twists. Now the second exercise that I will show you, there's no typical name, but we call it like the hands to your toes. So you're lying on the floor with the straight legs. Now you try to have as straight legs as possible. So you can bend them a little bit if that's too difficult. However, you would like to keep the very straight, nice legs. Now you have a dorsiflex, which means all your feet are trying to push the ceiling up. You're having your hands behind you and you're trying to reach to your toes as far as possible. And you go all the way up, all the way down. Again, you try to find one spot in the ceiling and you keep looking at that spot, which will prevent from using your chest instead of your core muscle. So again, you go from lying position up and up. And you try to reach to your toes. Now, if you want a little bit easier option. You can go from touch one toes to your hand, you go all the way down to the floor, and another one all the way down to the floor. You can do those, which are easier one, but they also help you to maintain a great ab core, maintain great core strength, abdominals, obliques, strong back. So nothing better than those two exercises. You can do them in a home environment, you can go to the gym, you can pick any type of weight to make it more difficult for yourself. So you can always try to be creative with exercises that you're gonna pick. Remember that the repetitions are the most important. More you go with the repetitions, better results you're gonna achieve. So that's it for today, and I will see you next time.
Thank you so much to Natalia. Now don't go away, because after the break we see how Emily Hodge fought with cancer and how it has renewed her sense of resilience. But first, is this true or false? Resilience can be learned. Find out if this is true or false after this break. Welcome back to the Chrissy B Show, everyone. Now, before we went to break, I asked you if this was true or false. Resilience can be learned. The answer is true. The Creative Centre for Leadership says that resilience is a skill, and like any skill, it can be trained and improved. They recommend recognizing your patterns and behaviors and trading habitual responses with new ones. With practice, the brain creates new neural pathways, and it's this way that habits are formed. And now resilience comes to us in many forms, and here to share her personal story of resilience is Emily Hodge. Hello, Emily.
Hello.
It's lovely to have you on, my darling. So you are a very bubbly person and very smiley and everything, but you have actually been through quite a difficult journey, but you managed to get yourself out of that. And now you are helping others, with similar kind of problems, or actually any issues that they're going through. So can you tell us actually what happened to you, first of all?
Yeah, of course. So about 7 years ago, I was diagnosed with bowel cancer. And as a 30-year-old woman, that was quite unusual and a very isolating experience. I've just got married, we were hoping to have a family, and obviously it kind of pushed me onto a whole other path than I probably didn't expect at that point. I was working in the NHS at the time, and I was obviously off sick for a lot of my treatment. Treatment was about 2 years, so for bowel cancer it meant I had quite a few surgeries and chemotherapy. And I think what happened as a result of that, it really spun me into a place where I didn't expect to be emotionally as well as physically.
How were you doing emotionally?
I wasn't great. I mean, I think it was a big shock. You go through this almost, the awareness that this thing has happened and this huge shock that it's happening to you. And to some extent there was a level of not being able to accept it. I don't think I was the best and most amazing patient. I think I was quite difficult and probably quite angry. And I think that was quite hard to express as well, because the idea of being, a lot of the stigma around kind of being ill is that you have this happy face and you're positive and you're really okay, but behind the scenes that is not always the case.
And you're scared as well, I suppose, aren't you? Like,
absolutely. Really, there's a lot of fear. There's so much unknown about what might be happening. I was lucky to the extent that, surgery meant that I no longer had cancer, and my chemotherapy was almost preventative to stop it from coming back. However, you still are living with that risk. You're still thinking about it most days. You're still worried that it could come back in 5 years' time. You're still concerned about all the things that you would love to be doing, like, will I still have my job? Will I be able to have children? What do my friends think about this? That none of them were necessarily going through it, and did they understand? Money worries potentially. All these things that you don't necessarily think would happen just because you get ill suddenly become very important.
Wow, okay. How did you actually get through everything then? Because, you said you went through those dark times, very hard emotionally and physically, actually. What did you do to cope, and how did you get through that?
I Hoped by, now I can see, I went through stages, and almost the very traditional stages of grief I can see I went through. At the time I wouldn't have been able to tell you that because you're in it, so you're not really reflecting on it. I can see now I went through the whole stage of kind of shock, depression, anxiety, and then through that you almost come to a place where you know that this is part of what you are. There's almost a realization that if I acknowledge that this is happening, if I know what I have control over, I can start to feel like I understand what the next stage is. That may not come actually, and I know this now because of the work I do, that may not come until many years after you've had treatment and many years after you've maybe had the all clear. It's just a very slow, gradual, I'm going to make this change, and then I'm going to allow myself to make this change. And I did that. Some of it was planned, so some of it was deliberate. I, left my job and I created a new kind of job for myself. Other things were accidental, so I found that I needed to go to a retreat once a month to kind of be in silence in order to not feel so overwhelmed with everything that was going on in my mind. So almost created a recovery plan for myself, I would say.
Which is great. I mean, it shows that you put a lot of thought into it and you knew what was right for you.
Well, that's exactly the point. Knowing what's right for each of us, because we're all so different. We all react in different ways to different types of support. We all like different things as well. And I think particularly around cancer, you can be told so much about what you should be doing. You should be eating this. You should be going to this yoga class. You should really read this book. You should and actually pulling back from all the shoulds and really just tuning into what you're feeling and saying, I would really like to do this thing, becomes really important.
It's really important what you're saying, Emily, because it's like thinking about family and friends that are genuinely trying to help, but then it's like you might be doing the complete opposite because that's not what the person wants to do or doesn't feel like doing.
Yeah, and often people really want to help and they'll maybe tell you this new piece of advice that they've heard, but ideally what they could do instead is say, do you want to know about this new thing that I've discovered? Give the patient the time to go, not right now, ask me in 6 months' time or tomorrow, instead of kind of passing on all this information that might be just too overwhelming for them.
So tell us what you've now created in helping other people with similar problems.
Yeah, so I, as a result of everything that I went through, I was working in the NHS before, and I felt like there was this really big gap between helping someone to really move forward from traumatic or difficult experiences, but also having the knowledge about some kind of health condition. So for mine it was cancer, but there are many more. There are chronic illnesses, there are acute situations that happen to us. And we often need a way or a plan of how we're going to gain that resilience and understand what's going to be the right thing for us. So I created this coaching program which really supports people when either they've been through cancer or other traumatic or difficult things in their lives.
Can you tell us about what some of the things, obviously you can't say everything here on the show because it's too much, but can you tell us some of the things that you cover in a bit more detail?
Yeah, so it's essentially a coaching based program, and that means that in essence, it's asking really good questions. So I might work with someone one-to-one, or I might work with them in a group program. If it's one-to-one, we get really into the nitty-gritty of what has been happening for them, where they would like to be. So where do they see themselves? Not necessarily the whole where are you going to be in 5 years' time, but more of the where do you want to be that feels really good for you? What does it look like? Imagining what their life could be like. But then it's getting very clear about what there is possible for them, because if their body's changed, if their mind isn't the same anymore, we have to work with their restriction or their ability now and get them really confident in what they can do instead of looking at what they can no longer do.
Very important, isn't it? And how has it been going? What's the response been like?
It's been really, really good actually. I work with some charities, and so I have quite a lovely sort of referral system with them, and the clients that come are often people who are perhaps already into the idea of coaching. They might have even had counselling before, Or they may know that instead of counselling, which potentially helps them to reflect and to look back a bit more, they want an idea of how to move forward.
Okay.
So people have really loved it, and I really adore my clients. I mean, yeah, it's really nice.
And because you've obviously been through what you've been through as well, you can understand them on a different level, maybe that maybe someone else wouldn't.
I think so. I mean, I try really hard to let that be a benefit, but not too much of I try not to bring too much of myself into our sessions, and it's their time as well, but knowing that that person understands what you've been through is really important.
It is. And what about the future for your business?
Oh, well, it's very exciting. I have a group program called the Gentle Life course, and that's really a bit more generic. It's for anyone who would like to lead a gentle life, bringing in all those coaching principles, helping them pull back from pressure, from overwhelm, from stress, from anxiety. People generally say no a lot when they come on this course. They start to stop things that they've been doing. Perhaps they've been too busy, or they've been spreading themselves too thin, and people generally feel very relaxed at the end of the course.
Okay, that's good. It's a good thing.
It's nice.
Just one final question, Emily, for you. If someone's watching now that is feeling really low, then maybe they've just been diagnosed with a sickness, something like cancer, for example, like you had, and they're feeling quite unmotivated, they don't know what to do, they think their life is over. What advice would you give to them initially, would you say?
I would say allow yourself to feel what you feel. It's only natural. It's probably been a big shock that this thing has happened, this diagnosis or this change in their life. It's all right to be angry. It's all right to feel not positive. And then to remember the things that you do like about yourself, because you can become your illness quite quickly. It can be your identity, because everything around you becomes about that illness. So remembering who you are, what you love, what your hobbies are, what you enjoy doing, what you can find enjoy doing whilst you're ill is really important.
Great advice. Emily, thank you so much.
Thank you.
And all the best with your business.
Thank you very much.
Thank you.
Thank you.
Well, everyone, don't go away, because after the break, Dr. Rob Hicks answers your medical questions, including this one. For months, I've had a rash that I thought was eczema because it runs in my family, but it doesn't itch at all, and I've read that's common for eczema. Can this rash be eczema if it isn't itchy? Find out what Dr. Rob Hicks has to say after this break. Chrissy B, and my show is all about improving your mental health and being happy. Join me every Monday, Wednesday and Friday at 10 p.m. on my channel Sky 203. Visit chrissybshow.tv for more information and subscribe to our YouTube channel Chrissy B Show. You can also follow us on Twitter and Instagram at Chrissy B Show, and on our Facebook page, The Chrissy B Show. Welcome back to the Chrissy B Show, everyone. So now here to answer your medical questions is our resident Dr. Rob Hicks. And if you have a question for him, all you need to do is email us on doctor@chrissybshow.tv. Welcome to the show, Rob.
Hi, Chris. How are you?
I'm good. How are you?
Very well, thank you.
What do you think of our donut display?
Oh, it's donuts. I thought it was old fruit.
No, I was kind of thinking we should have apples in here instead, but they won't really fit very well in here.
Well, everything in moderation, isn't it?
Yes, that's exactly it. So shall we get straight to the questions?
Let's go on.
Okay. So for months I've had a rash that I thought was eczema because it runs in my family, but it doesn't itch at all, and I've read that's common for eczema. Can this rash be eczema if it isn't itchy?
Very, very good question. The answer is it can be. To be fair, usually with eczema it is very, very itchy, but it doesn't have to be. The skin can simply be dry, flaky and red, and it may feel uncomfortable, from a discomfort point of view rather than an itching point of view. I think the important thing with any rash is it needs to be seen so that the right diagnosis can be made, because it could be that just because you've got eczema in the family doesn't necessarily mean you're going to get eczema, and what you might actually have is a different skin condition, something like a fungal infection or psoriasis. So I would get this looked at, and then you'll be given the advice as to what is the best course of treatment for your particular rash.
Okay, Rob, thank you. Next question. My fiance has suffered from type 1 diabetes for the past 25 years. He has developed insomnia related to his diabetes. He has tried many types of sleeping medication, but most have been unsuccessful unless he takes several pills. Doesn't sound too good, does it? And is there any type of treatment that can treat this without causing a major shift in his blood glucose levels?
Yes. There's lots of things. I mean, one of the things to think about is what specifically is responsible for the insomnia. So with people who've got diabetes, particularly when it's not particularly well controlled, is they have to get up at night to pee a lot. So is that the reason why he's not sleeping well? Is because he's actually being disturbed having to go to the bathroom time and time again. The other thing to think about is, from an emotional point of view, is having the diagnosis of diabetes actually worrying him now? Has he been told that maybe the diabetes isn't as well controlled, or maybe the diabetes is already affecting parts of his body, his kidneys, his nervous system, for example? So has something happened where he's had a discussion with his doctor and been told, well, look, your diabetes is causing some complications, and is that keeping you awake? What I would urge you to do actually is think of the sleep hygiene measures that you can put into place to try and overcome insomnia without the use of medication. And we've got a very, very good doctor's orders segment on ways of naturally helping yourself get a good night's sleep. It's on the website. The other things to think about really is whether sometimes when diabetes is not well controlled, that can influence insomnia, can cause insomnia, it can be related. So get your partner to have a chat with a doctor to see whether it's appropriate to actually to improve the control and management of the diabetes in the first instance. And then the other thing is to look at, what are the other underlying triggers that might be causing a problem that's not related to diabetes at all. So is it about noise? Is it about the fact the room isn't dark enough? Is it about anything that's on his mind that's worrying him? So, and then once you've identified what the specific triggers are, then you can actually address them. And then when that happens, the knock-on effect is often that the sleep comes back. The other thing to think about is it actually stress, anxiety or depression, which is so separate or potentially linked to diabetes, which is causing these symptoms? And in which case, if that's causing the sleepless nights, then if those are addressed, then you have a better chance then of getting a good night's sleep.
Okay, wonderful. Next question, Rob. I have a small green ball-shaped thing that is going into the back of the tip of my penis. What could it be? I'm a virgin, so I don't think it's an STD.
Well, there's one important bit of advice with this, and this needs to be checked out. This is one of those scenarios where the doctor has to examine this to see exactly what it is and then recommend the ideal treatment, the most appropriate treatment. It's probably something like a blocked gland which is causing a cyst. The other thing is you don't actually have to have had penetrative sex to get an STD, so it could be that this is a gentle wart, which is passed with skin-to-skin contact, for example. What I would urge you to do, obviously, is get this checked out, particularly if you've got other symptoms like discharge, pain when you pee, or having to pee more frequently than you would normally do.
Okay. Next question, Rob. Can mental illness be due to a physical problem, such as mental illness due to an underdeveloped brain?
The answer is yes.
Okay.
Yeah, mental illness can be due to a physical problem, it can be due to emotional problems as well. So to answer your specific question, yes, there's evidence that delay in brain development or a lack of brain development puts somebody at a greater risk of developing mental health problems. But also let's think about there are also physical problems which can cause stress, anxiety and depression because they're long-term conditions. So for example, we already mentioned one of our other viewers' questions about diabetes, that any health condition that's long-term and can't be cured, people often find that they then develop a secondary mental health problem. And maybe that's because it's a painful condition and the pain isn't controlled well enough and it's making their life miserable. It's affecting how they work, affecting their social life, it's affecting their relationships, for example. So the answer is yes. There's lots of different reasons why mental illness might develop. Now the important thing is, no matter what the reason is, that it's dealt with, it's identified, it's diagnosed and it's treated properly, so that actually you get this benefit to, let's say, a long-term health condition, because actually if you deal with a depression, then you're better able to deal with, let's say, a painful condition, and vice versa.
Okay, brilliant. Next one. Do children need milk tooth fillings? If the teeth are going to fall out anyway, I don't see the point.
That's a good question. That's a good question, because the logic would say, well, if it's going to fall out, why bother with it?
Yeah.
However, the answer is yes. They do need to be looked after, and they do need fill-ins. The reason being is that if they're not treated properly by the dentist, then there's a risk that infection will spread, not just further into the individual tooth, but actually to other teeth as well, causing further problems, which may be pain, maybe the teeth actually falling out. The other thing is that damaged or baby teeth can actually make the development of adult teeth abnormal. So yes, you want to get the baby teeth dealt with properly. The other thing is, we need teeth right from the beginning, from childhood days, to make sure that speech development is correct and that we can chew properly as well. So the answer is, although I like your question, I think it's very logical to think that you don't need to have it dealt with or treated. The answer is yes, you do need to have it treated.
Okay, good to know. Next question, Rob. I'm getting pain and swelling on the bridge of my nose. I wear glasses every day, but never had this pain before. Does it mean something is wrong with my sinuses?
Possibly, but normally with sinus problems you get swelling in the inside of the nose, not on the outside. It's possible, but it's unlikely.
Okay.
The most likely reason for this is, I would ask you, have you got new glasses, or have they been damaged in some way? So is this swelling actually because of the glasses not fitting on the bridge of the nose properly, or they're actually irritating and causing inflammation, and that's causing the swelling on the nose? Is it that you've scratched the nose, you've got a minor infection there, and the glasses are simply irritating it and making it worse? So those are the sort of things that spring to mind. The other thing is, you need to get this checked out to see whether there's any specific treatments needed. In the meantime, what I would suggest you do is go to the optometrist, the person who supplied the glasses, and make sure that they're actually fitting correctly in the first place, because often that's the solution. The glasses are not fitting, they're rubbing when they shouldn't be, and the rubbing is causing the swelling and the discomfort.
Okay, and last question for today, Rob. I have found that my eyes are really red and itchy in the mornings. I've tried replacing my pillows, changing my sheets, and changing my laundry detergent, all to no avail. What else could possibly be causing this problem? I don't wear contacts, and otherwise the redness and itchiness clears up as the day goes on.
Well, well done to this viewer who's already taken a lot of steps to try and identify what the problem is, which is great. It sounds to me that this is some kind of allergy. This sounds to me like allergic conjunctivitis, which essentially is the red itchiness of the eyes that you get with hay fever, for example, or other allergies. What I would advise you to do is get your eyes checked to start with, even when you haven't got symptoms. Have an eye test, and also get your doctor to have a look at your eyes. What are the likely causes? It sounds like there's something irritating your eyes at night, and it could be the fact that you're allergic to house dust mite and the house dust mite droppings, and we've all got them in our homes, and certainly one of the greatest concentrations is in the bedroom, in mattresses, in duvets, in pillows. If you've got maybe a pet, or maybe a new pet, and you've been allowing that pet to come into the bedroom, maybe it's an allergy to the proteins that you find on pet hairs. That's causing your problem. So one of the things to try in the first instance is to try and reduce the concentration of those potential allergens, and you can do that by banning the pet if you've got one from the bedroom, and the other is by damp dusting the room, and then using ideally a vacuum cleaner with a HEPA filter to try and reduce the concentration of house dust mite. You can't get rid of house dust mite totally, but you can reduce their concentration, and see if that makes a difference. And you might want to consider the allergy covers that you can get for pillows and mattresses as well, to see if that helps. Your local pharmacist and your doctor will probably suggest some eye drops to ease your symptoms in the meantime. But generally speaking, when you pinpoint what's causing the problem and you use some medicines like eye drops or antihistamines, you usually get rid of the symptoms and can keep things under control.
Brilliant advice as usual, Rob. Thank you so much.
Can we tuck in now?
Yes, you can. Well, I'm going to do a link to break, and you can tuck in, and we'll see you again next week. Thank you. Well, everyone, don't go away, because after the break we have resident coach on Chris Browne to give some useful tips before I give you my own tips on how to be more resilient. But first, how many people suffer from work-related stress? Is it A, over 500,000, B, over 1 million, or C, over 2 million? Find out the answer after this break.